In this video, we will discuss why the cellular mechanism matters, revisiting the DNA synthesis story. Let us return to the fundamental biochemistry and make it as clear as possible, because understanding this mechanism is what ties the entire topic together. Both vitamin B12 and folate participate in a shared metabolic pathway that is responsible for synthesizing thymidine monophosphate, one of the 4 nucleotides that make up DNA. Thymidine is unique among the DNA building blocks because this is the only one whose synthesis directly requires folate in its active form. Vitamin B12 is required to regenerate active folate from its inactive form. So B12 deficiency leads to a functional folate deficiency within cells, even when folate itself is present in adequate amounts. This is sometimes called the methylfolate trap, because folate gets stuck in an unusable form. The practical consequence is that cells which are dividing rapidly, red cell precursors, white cell precursors, platelet precursors, mucosal cells of the mouth and gut, are the most affected because they have the highest demand for new DNA synthesis. Cells that are not dividing rapidly, including most nerve cells, are less directly affected by impaired DNA synthesis. This is part of why the anemia and pancytopenia develop from impaired DNA synthesis in the marrow, while the neurological damage from B12 deficiency arises through a separate biochemical mechanism entirely. The neurological damage from B12 deficiency arises through a separate biochemical mechanism entirely, related to B12's role in methylation reactions necessary for myelin maintenance, rather than from the DNA synthesis defect alone. This separation of mechanisms explains the paradox of why folate deficiency, which also blocks thymidine synthesis, does not cause neurological damage. The myelin maintenance pathway requires B12 specifically, independent of folate. The autoimmune nature of pernicious anemia has clinical implications beyond just the gastric pathology. The known association with other autoimmune diseases, particularly thyroid diseases, means that a patient diagnosed with pernicious anemia should prompt clinical vigilance for coexisting thyroid dysfunction. Conversely, a patient with established autoimmune thyroid disease who develops anemia should have B12 deficiency and pernicious anemia considered early in the differential diagnosis, precisely because of this clustering tendency. The association with increased gastric carcinoma risk means that patients with pernicious anemia, and by extension autoimmune gastritis, warrant appropriate surveillance for gastric malignancy. The chronic inflammatory damage to the gastric mucosa and the achlorhydric environment it creates are associated with increased cancer risk in that organ. We will conclude the topic of megaloblastic anemia in the next video.